Hello, my name is Victoria Palacio Carr, and I'm with the Legal Action Center's No Health Equals No Justice initiative. Our initiative's mission is to uplift and advance community driven solutions that address systemic racism and promote health of the mind and body. Our initiative is informed by our state and local partners, who include direct service providers, individuals with lived experience, and other advocates whose work intersects with healthcare access and criminal legal system reform. As we all know, there are many threats from Washington to critical health and social services and resources around the country. As we've shared in our previous video, Medicaid is an essential program for millions of individuals, families, and communities. But unfortunately, it continues to be at great risk for devastating cuts and policy changes that will make it harder for people to access needed health services, medications, and supports. We want to update you today on the status of those potential Medicaid cuts and talk with you about some specific ways you can help. We need your help. Nothing is a done deal, and your voice makes a difference. I will now pass it to my colleague Gab to talk with you about what's been happening in DC on Medicaid.
Thanks so much, Victoria. So we wanted to update you on the latest around the potentially really enormous cuts to Medicaid, which we know would be devastating to millions of people around the country. So in Congress, the last step is that the House last Thursday, the 10th, passed a budget blueprint that aligns with spending targets in the Senate. And so, what that means, we know that Congress plans to use a process called budget reconciliation to try to extend the 2017 tax cuts, which really benefited the wealthiest people in this country. But to do that, they need to cut a lot of other programs and funding. And Medicaid has come up as a really big target for those cuts. The committee in the House that is charged with oversight of health programming and financing has identified $880 billion in cuts to Medicaid that are potential. And so, a few things that we want to let you know. So, first of all, that budget blueprint and having the House and the Senate Republican leadership being aligned is a first step, but there are tons of decisions left to make. And it was difficult for the House to even get that vote all the way through. It was a very tight vote, 216 to 214. So a few things we really want you to know. So first, again, those margins are really tight and your voices are incredibly important, and your outreach to your representatives to tell them to protect Medicaid, to not cut Medicaid is really critically important. Second point is that your members are home right now. Your congressional representatives are home for the 2-week recess, and it's a great time to reach out to them. And we'll talk more with you about different ways you can do that. The last thing I want to tell you is that the messaging around Medicaid has really recently shifted among Republicans. There has been a huge amount of work around the country that's from all of you, which has been incredibly helpful to really demonstrate how popular a program Medicaid is. And the support is really broad and diverse across all kinds of demographic lines, political, ideological lines. People do not want Medicaid cut. And so Republicans have shifted from talking about cuts to Medicaid to talking about ways that they want to protect Medicaid, but change the program slightly or do certain things to the program. So Debbie is going to talk with you now about what that messaging really means and what the reality really is.
Thanks, Gab. We thought it would be really important for us to show you some of the reasons that folks are saying we need Medicaid cuts versus the real situation. One of their arguments is to cut Medicaid is that to look for fraud and abuse. And they say we're only going after improper federal programs that create fraud and abuse in the program with no harm to enrollees or Medicaid beneficiaries. Well, we thought it would be important to take a closer look at that argument. And we found a couple of things. The most basic thing we've found that Medicaid enrollees should not be penalized for bad actors or administrative errors in the Medicaid program. Now, that's based on two studies that we looked at. One was a 2024 Department of Justice report that recognized that the range of those entities and individuals convicted for Medicaid fraud include providers, suppliers of durable medical equipment, pharmacies, pain clinics, nursing homes, and labs, not any individuals. They, like I said, there were entities and providers. The second thing we found was a 2023 analysis that was done by the Department of Health and Human Services, the Centers for Medicare and Medicaid Services, otherwise known as CMS, that found that 82% of Medicaid improper payments occurred because of insufficient documentation, usually because of a missed administrative step or by providers or states. Again, Medicaid beneficiaries or enrollees had nothing to do with those incidents of fraud or abuse. So our reality check for this argument is if federal payments to states for Medicaid are limited, that will not address any type of fraud. But what that will do is hurt people who get their health insurance from Medicaid by limiting the types of services, the scope of services that are available for them, and also limiting individuals' eligibility in their states. This is just a smokescreen, the whole fraud and abuse argument, for justifying a way to cut Medicaid. So don't fall for it. Let's go to another argument. Another argument we've seen is there's been conversations on the other side to repeal the Medicaid expansion of eligibility in states. And the argument is Medicaid coverage should only be available to those who are most vulnerable and deserving, like older people, children, and people with disabilities, not childless adults. Well, we took a closer look at this argument as well. This argument doesn't address the situation that and the reality that Medicaid is an entitlement program and what that means. Anyone who meets the eligibility criteria for the entitlement program of Medicaid in their state is eligible for services and can enroll in that state. Now, that has nothing to do with deservingness or that type of argument. The Medicaid expansion of eligibility provides healthcare coverage to previously uninsured people who are low income, and that includes low income workers who've improved their access to substance use disorder and mental health care services and treatment. And the Medicaid eligibility expansion has also produced a significant amount of savings to states because of improved health and justice outcomes. So here's our reality check for this particular argument. States that have expanded their Medicaid eligibility criteria, they've done a good thing for the state itself and for people who live in that state. And we've seen research that says that states that have done this for low-income adults help to improve health outcomes for those individuals. And that includes a great proportion of people who have chronic health conditions and disabilities, older people, and children. All of these people deserve Medicaid. So there is no line of deservedness in Medicaid. Everyone who's eligible deserves Medicaid. So remember, this argument, repealing the Medicaid expansion of eligibility in states, is just another way to cut Medicaid. Okay, we're looking at one more. Now, there's several of these arguments that we've seen, but the work requirements one is another one that keeps resurfacing. So their argument is for work requirements, people should be required to work to be eligible for Medicaid. All right, we're going to take a closer look at this one. We found that most people, and research has backed this up, most people who get their health insurance from Medicaid and are able to work, and they are working. A lot of these folks are low-income wage workers who don't have access to employer-based health insurance. So they need Medicaid to have health insurance. And to create a work requirement and to proof of work requirement um, eligibility for Medicaid would create nothing but unnecessary red tape that results in less people getting coverage. And it really does not work. We see this right now in Georgia, who has a work requirement to their Medicaid expansion of eligibility program. And we've seen less people being able to satisfy that requirement. So less people are being able to access Medicaid. So our reality check is the work requirements reason for putting this into eligibility for Medicaid really just produces harmful problems for people already experiencing barriers to employment who need healthcare access and services. So we're talking about people who have criminal legal records, caregivers, people with disabilities, and others. So the work requirements argument is just one another way to cut Medicaid. Now, there's other arguments out there, changing the financing. There's a lot of other ones, but we've talked about three of the big ones that we've seen. So what should you talk about when you meet with your legislators or when you call their offices? Well, we thought we'd help you out and give you some effective arguments to protect Medicaid. One is that you could just tell them that how Medicaid has played an important role in reducing overdose rates and expanding access to substance use and mental health care and other services as well, maternity care, long-term care, nursing home care. We can go on and on. And another argument is how Medicaid supports people so they are able to work. We just saw before that a lot of folks are already working. But they don't have access to employer-based health insurance. So if they have Medicaid, they can still be healthy enough to continue to work. A third point is storytelling. Now, we don't really mean to make up a story. We mean to tell your story, to talk about how important Medicaid is to you and how it has improved your life and the life of your family. Tell them because you have Medicaid, what happened in your health situation. And finally, the best framing is just simple. Tell them don't cut Medicaid, leave it alone. Because you know that if you cut $880 billion from the federal budget, this is going to hurt people on Medicaid and their families. So keep your framing simple and get to the point. They will get the message. So I'm going to turn it over to my colleague, Victoria, who's going to tell you more about what you can do.
So now's the time to act. Conversations around Medicaid's budget are currently underway. Any of the changes we've discussed will hurt so many people, including folks with arrest and conviction records, people with substance use disorders, and those with mental health conditions. You may be wondering, what can you do now? Well, this week and next week, our members of Congress will be back in their districts. So now's the time to attend town halls or public meetings, call, email, or write your member's local office, request a meeting, write an op-ed or a letter to the editor of your local paper, and let your members know that you need them to protect Medicaid. Most importantly, we need your help getting the word out about these cuts. Please tell your neighbors, friends, and loved ones about the importance of Medicaid and the potential threats to it. Post about these threats on social media as well. Lastly, the Legal Action Center is collecting stories about the impacts and benefits of Medicaid, SNAP, and other public programs. If you want to share your story about how Medicaid has supported you and has been a vital lifeline in your life, please visit LAC's website and check out our Faces of Medicaid webpage. There will be descriptions below on how to access that website, along with other resources from the Legal Action Center and our partners around how to advocate for Medicaid. There's still time. Together, we can protect Medicaid.